We are live now with Dr. Chris Reynolds, otherwise known as Dr. Wheatgrass. So what we wanted to do today, because we had an interview before, and there was a lot of interest in the wheatgrass extract and these different applications of wheatgrass. And I'm going to give you a quick case study of a person that I recommended this to, somebody who had bad skin in their back for most of their adult life. And it never cleared up no matter what they did. And then they used the spray on it. And then within about 4 to 6 weeks, I think it was totally cleared up for the first time in their life. So that's one case study that I know of personally. But what I wanted to do is turn the talk over to Dr. Wheatgrass, who's done a lot of research and a lot of great cases. And most importantly, he's come to wheatgrass because it's helpful and beneficial and reduces suffering for other people. So with that said, I'd like to say hello to Dr. Wheatgrass and welcome to our live broadcast.
It's great to be back. You've done a great job for us, Joe, I think, in terms of, because I've had quite a lot of response from the last session, and a lot of questions, medical questions, which is what I'm after, because that's what I do. I'm not a marketer, but I just love working with the wheatgrass because of, as a doctor, it's made my life so much easier than it would have been otherwise, and particularly in seeing conditions like leg ulcers that don't heal, and even amputations that have gone ahead that really you look at it and you think, well, maybe we could have prevented that. And because I think the mindset behind the treatment of such conditions is more physical rather than physiological. And that's where the wheatgrass comes in. It comes in at a different level, and it can actually help restore damaged tissue. But it doesn't restore anything, and that's something that we can perhaps talk about later on, and how it probably works, how I think it works anyway, after 27 years experience working with it. And it's people like you that are prepared to stick your neck out and say, well, look, let's have a go at this, let's have a look at it and see what it's doing. And I think from what you say, you're finding that it can be quite helpful to your patients.
Yes.
In certain areas, it's no panacea, but it's the closest thing I've ever come across to it in 37 years of medical practice, or longer than that actually, when I first came across it. To the extent that my response was like I'd just been hit on the head with a sledgehammer. I couldn't believe what I was seeing. And that's what's driven me ever since. I've had a lot of patients coming through, in particular from the United States, for people with chronic leg ulcers, venous ulcers, arterial ulcers, etc. And we're not healing the ulcers so much as restoring the tissue to its normal state. But it's not the graft that's doing that.
Yeah, I'd like to get a little bit more clarification, because that's kind of the magic that's going on. It's actually what you and I talked about the last time. And by the way, for the people that have met you the first time, you're coming in from Australia, by the way, and you've been doing wheatgrass for 27 years, just to give a heads up for the people that are here. But in terms of that very specific detail, two specific details, I think that would be really good for people to understand. Number one, less is better sometimes. But number two, it's actually healing the tissue on very dramatic situations. Can you give us more information on that for the people?
Yeah, well, I think the first thing to say, Joe, is that it's not the grass that does the job.
Okay.
What the grass does, from my thousands of observations of healing, etc., over the last 27 years or something, is that the grass actually assists or notifies the brain of what's happening at the periphery, and not just on the skin. I'm talking internally as well.
Like I say, from my own perspective, as soon as we met, I've been introducing this to people for a really long time, and always having very good results. As I said, even with a quadriplegic, with increasing, you know, nerve awakening, I should say, and other people like that. So it's really amazing stuff. So it's good to know about why it works and things. One of the questions, though, in terms of the dosage, so I think it's really important for people out there to understand, because I know I got it wrong at the beginning. I always thought more was better. So can you give us a little bit more of the idea of how profound this is, that actually less is creating what you're talking about, that connection, and doing more might even be not as beneficial. Can you explain that to us?
Well, I suppose if I was in your situation, I wouldn't think so much it was profound, but more like crazy. But of course, that's been the most difficult thing to get across, the point. And it took me a long time to realize that that was the way to go. And it was almost through clinical accidents, and no one's causing any problems, but I started to realize that the using less was best, and the less I used, the quicker these people patients were healing. And there was clearly a significant change in the response, and it's not a thing that you overtreat with. But this young man came in, and he'd had this split in his lip for a year, and he'd had everything, his steroids, antibiotics, you name it, and he had a whole list of medications that he'd had.
Sure.
And it was very painful. And he didn't go out. He locked himself up because he felt so embarrassed in mixing with his friends, and he couldn't smile without crying. So,
wow. Yeah.
The poor devil. No, it's a very, very sensitive area. And anyway, I gave him a little bit of the cream, the wheatgrass cream, and I put a bit on for him, just showed him just to use a little bit as sort of heavy medicine. It's sort of very basic, but on the other hand, he came back a week later and he was smiling and he was very happy, and that's how his lip looked. So and this has happened to me many times, and I remember I was in my first day in a clinic in Melbourne, because I was doing locums in different areas, because I'd just come over from Perth, I'd emigrated from Perth, and I was finding my way around. And I rolled up at this clinic, and it was a big one. There was 5 or 6 doctors working there. And there was a kid screaming his head off when I walked through the door. And somewhere in the building, I wasn't sure, and I thought, God, I hope I don't get him. Well, who got him? I did. And mother came in with this, he was about 2 years old, and he was screaming with the pain. He always had a shocking headache, and he was hot as hell. And I used I had always had a lolly jar, you call a candy jar, little lollies in for little kids, on my desk. And I took the lid off. This is my Reynolds test. I took the lid off and offered it to him, and he sort of pushed it away. So I said to his mother, do you mind if I rub some of this cream on the back of his neck? Well, you can imagine the look on her face, that she's sort of looking for the escape, where's the door sort of thing. And I could feel that. But on the other hand, I knew that it had worked for this woman. Yeah. And anyway, she said, oh, no, doctor, that's all right. And so I did. I just rubbed a little bit on and popped him up on the couch and had a look at him, and he seemed to be all right. But he was grizzly, and he was mummy, and I'm sort of hot and hurt. He was only a little kid. And so I sat down and started writing the notes and things. And then I got up, went to pick him up and bring him back, and I offered him the lolly jar again, and his hand went straight in there. And I knew that I'd won. And his temperature come back, and he was laughing and carrying on and running around the room.
That's great.
Well, that wasn't the end of the story, because he went out. See, it was my first day in this clinic.
Oh, wow.
Yeah, and it was my first patient on the first day.
Wow, good job.
And I was living dangerously. And anyway, the receptionist came rushing in and she said, "What did you do with that little boy?" And I thought, "I don't think I killed him," but and I said, "I just rubbed a bit of cream on the back of his neck." "Oh," she said. I thought, "Well, who are you anyway? I mean, you'd be questioning what I'm doing, you know." And I thought, well, I better play ball because it's a big clinic. I don't want them all attacking me at the same time. The next thing, the boss doctor called me in, the owner of the clinic, and he didn't offer me a seat, but I thought he wanted to come in and just wanted me to come in and discuss the grass with him and something positive.
Yes.
He said, "What's this stuff you're putting on this kid's back, kid's neck?" I said, "It's just a herbal abstract, extract." And he said, "Well, either you stop using or you leave."
Wow, that's.
I said, "Well, I'm leaving." And I said, "Don't forget to pay me for coming out here," and he did.
Wow.
But that sort of summarizes a lot of the and understandable reactions from my colleagues. I knew that. I was well aware of that fact because I knew how I'd felt, but I knew I was onto something different here, something I'd never seen before. I'd never seen somebody with, get a fever going like this, and I had 2 in a row here, and then I had a lot more after that. I was getting guilty about not doing any work or enough work in the field. And I volunteered to do a couple of weeks in a small village in Fiji. And that was a real eye-opener, and it was a great experience. But my second patient that came in, because we're in a village, and because the doctor had arrived, the whole village came to the clinic. And it was a very busy day. But you get used to that in medicine. And it was so interesting, and such nice people. And but this man came in, he was hemiplegic. He couldn't walk properly. He had to, he had a stick, and he was walking on the side of his foot, and he was, completely paralyzed, and his hand was clenched up. There's a video of this on my site. Talk about this because it was fairly important in my view.
Yes, it
was. And he, I noticed I was still in a very early experimental stage with the wheatgrass, and I hadn't actually tried it on somebody with a stroke. And I said, "Do you mind if I put some of this cream on your hand?" And when I was saying it, I was saying to myself, "What are you doing?" It seems to be some sort of voice saying, "Try this, try this," and I put it on, and I thought, well, yeah, okay. And he only had a cold or something. I had a quick look at him, and so probably 5 minutes. I said, "Anyway, let's see if you can move that hand." He said, "I can't, doctor." He said, "It's locked." I said, "Well, just try." I don't know what drove me to do that. And I said, "Okay, try. And he started moving like this. And it was slow, and he started moving, and his eyes were popping out. But so were mine. and this... he came out to a full open hand.
Wow, that's amazing. I think that video is one of my favorite videos of all your stuff.
And of course, it got around the village like crazy, and I was very busy for the next 2 weeks.
I bet.
but on the following weekend, we found I got one of the local drivers from the hotel I was staying in. He knew where he lived. He took me up to his place. Because he was hemiplegic, he couldn't. He had to walk with a stick, and he couldn't drive. But when I got there, I said, "How's it going?" He said, "Oh, it's good, doctor. I can move my arm now. I've been putting it on my shoulder." And I thought, this is too much. And anyway, we got him. I got him back to the clinic because he's still walking on the side of his foot.
Mm-hmm.
And I asked him not to put it on his leg at all. Let's see what could go. And I've actually got his wife to come, and she filmed me while I was putting the stuff, or a bit of the cream on his foot, around his foot and his ankle.
Yeah.
And you can see him standing up, and you can see his foot on the side, And then he starts moving across the ground, and as he's moving, his foot is going flat.
That's
That's
great.
how quickly it happened. Now, I called a friend of mine who was a neurosurgeon in Perth, and told him what, because I don't think I've ever felt so lonely in my life when I knocked off that day, because what am I dealing with here? You know, it was a shock. And so I told him what happened, because I thought, well, you know, maybe I can get some ideas here. And you know what he said? Double-blind studies, Chris, double-blind studies, and hung up.
Wow, that was it? That's all?
Yeah. Well, I mean, you know, I didn't feel good about that, because I thought, well, you know, at least we could have had a chat about it, you know, and say, I mean, something has happened here. But see, there's been that barrier ever since. And for 27 years, there's been that barrier. But I can understand the other side of the barrier, because I was exactly like that myself. I was just blinded to anything else but essentially big pharma or modern medicine, right? There's some amazing stuff out there by big pharma, amazing stuff. There's no question about that. But there's also a lot of stuff on the other side of the fence. I was over in India, and in a burns hospital there, working with the consultant there was very keen to use it on burns, and on second degree burns, which is the only thing I ever recommend it for. It's no good trying it on third degree burns, because there's no means of contacting the brain, because the skin is so badly damaged.
Okay.
And that's a horrible thing to happen to anybody. This young man, we were in outpatients with a consultant. There were 2 doctors from the hospital, registrars, and there were 4 students from the UK were there as well. And he came in, and he was like this. I don't know if you can see, but he couldn't move his arms above that area, that level. And I said to the consultant, I don't know why I did it again, but I said, can you ask him for me to put some of the spray on, some of the Wheatgrass spray? And she was behind me. She was forward, you know. She was very, very open-minded about it. And so I did. I sprayed him over all these areas over in front of his chest, etc. He was stiff. He just couldn't move, and his life was finished. And that took about 5-6 minutes, and I said to him, can you move your arm? He said, no. I said, will you try? He said, yes, I will. And you could see gradually his arms were going up like this, and everybody's eyes were sticking out.
Wow, look at that, yeah.
Particularly mine, you know, because I'm forever saying in those days, what am I going to see next? But I'm still having that. Well, it's a good problem to have, but it's still happening today. Because there's a very broad spectrum of conditions here that can be helped with the grass to a certain extent.
Yes.
So there were other things that happened in that hospital. There was a little boy, and he had severe burns all over the back of his buttock, and it was a big wound. And the consultant said to me, will you come and have a look at this kid? And I said, yeah. And she said, well, do you think the surface of the wound was glistening? I'd never seen anything like it, because you don't tend to see that in Western hospital because of the antibiotics and the treatment. You usually get on it very quickly. It was a good hospital, but they were poor people, and they can only get so many days, free days. They got a few free days a year, sort of thing, in the hospital. And she said to me, this wound, it was glistening.
Wow.
And it was glistening because it was infected.
Yep.
It was just teeming with bacteria. That's why it was sort of, you know, and I'd never seen anything like that. And she said he's going to die very soon, because their parents don't have enough money to keep him in the hospital any longer. And he will go home and he will die at home. And I said, well, she said, do you think your spray might help him? And I said, to be quite honest, I haven't got the faintest idea. I said, I've never been challenged like this before. This is a huge problem. The whole room was full of people.
Really?
This is India. This is medicine in India. Yeah.
Yep.
It's really a community thing. It's really
Community thing, yeah.
you know. And his father was there, and he spoke to him. He said, "Well, you let the doctor put some of the spray on the wound." And he said, "Yes, that's all right. That's okay." And I went to one corner and just gently sprayed it once. And he jumped a bit, and then he said to his father, "I don't want any more." So he said, "I don't want any more." So the surgeon said, "Well, he's finished." And she contacted me the next morning. She said, your spray has saved his life. She said, overnight, the wound has dried completely, sealed over, and his fever's gone, and he's going home. This is my favorite area because it's such a huge problem. And I know it's very bad for the patient to have to suffer from this. It's also very bad for the doctor because it's extremely difficult to overcome this problem. And this patient was from South Africa, actually. His relatives contacted me and wanted to know if we could fix his leg ulcers, and because they were considering amputation because the circulation was so bad.
Okay.
They were worried about gangrene occurring, and then they'd have to chop the foot off anyway.
Wow.
And is it likely to work? They asked me, and I said, yes, it is likely to work. But I didn't expect it to happen quite so quickly because it's here, as you see, in 9 weeks, there's an extraordinary improvement here. The question is, why does the varicose veins, why does the circulation to that area, why does it break down?
Right.
Well, again, this is a breakdown of cell receptors, not being able to transfer or transmit accurately what's happening at the periphery, be it wherever it is, be it internally or externally. Once that breaks down, the brain shuts off because it's not being told. It's not getting the
Right.
feedback that it needs to be able to react. Well, they were, as I say, they were considering amputation because the ulcers were just going to get worse. Well, if you look at it from another angle, that if we can restore somehow the circulation, and there's lots of things that can happen to veins, to lymphatic channels, to arterial supplies, and in that periphery, in that sort of distance from the heart, can have terrible effects. And so this is something that I've done with or seen with many patients, but this was a very strong display, I think, of just how effective the wheatgrass can be. But it's not the wheatgrass that is returning the blood circulation to that area. All it's doing is signaling or restoring the signaling process. You know much more about this than I do, so I should get you to talk about it.
No, I don't think I can talk better about it. But from what I've learned from you is basically, as you say, if I understand this correctly, in the example, there's a lack of blood circulation, but it's not a matter of that the blood is deficient. It's a matter that the communication to the foot to increase blood circulation is deficient. Is that a good way to put it?
I think that's what's happened here.
When you say don't use too much, what does too much mean? It seems you don't want to overdose, and actually too much is not so good.
Oh, well, thank you very much. Thanks for the question. Too much is once a day 3 times a day, cut it back to once a month.
Wow, that's amazing.
For that, because you've got to do it very slowly. And see, it's very hard to get that message across in the Western environment, because we're three times a day at least, people.
Yes.
But here you're dealing with something that it's not treating your foot. It's signaling to the brain that you've got that problem. It's a very different concept. And I'm surprised actually at this moment that I'm actually saying it to you in public.
To basically complete it, it sounds to me in a simple way for me to understand it is that you're giving the body a nudge, and then the body is basically doing the heavy work and the heavy lifting once it has the message.
Yeah, it's a restoration. It's a restoration of the physiology, basically.
Okay.
That's been disturbed. And to me, there really shouldn't be any need for certainly amputation or for removing people's veins or anything like that. You need those veins. You need that venous return. It's a normal thing, part of us, and we should be trying to restore that.
Yep.
And that can be done.
I think the key is that you can't dispute the evidence here, and I think that's one of the best parts about. And I appreciate you coming back and showing us more of these the actual evidence. You can't argue against results. I mean, people may be curious, like your doctor, your boss before that you worked for one day. I mean, they have to at least be curious, but you can't dispute the evidence. I think that's the bottom line. I'm hoping that people will take away from today. We're showing this amazing evidence of these different cases for people to understand how amazing this really is. And this is one that you gave us here today, which I thought it's just like incredible. So if you could tell us about this one, that would be.
Well, this is one of the most extraordinary things I've ever seen. Is a young American child, or child in America, I should say. And she was born with an Omphalocele where her intestines sort of force their way through, basically into the, or through the umbilicus, through the belly bone. And I won't get into the details of that, but what's happened is this child has been in hospital for a year.
Wow.
And the mother's been visiting her child every day for a year. She sent me an email and asked if the Wheatgrass would help, and I said, I have to be very honest, I haven't got a clue. I don't know, but it's worth a try.
Yep.
And that's what happened. As you can see there, 8 days after, and you can see the difference between it's like a reddish area here. So a lot of this is inflammation.
Yes.
And the abdomen is fighting to force the intestines back in and to cover it over and to regrow itself. So it's inflammatory, it's being pushed, etc. And also the skin is very thin there, so the blood supply can be seen through the wall. But I spoke to her mother, and she put the balm over it with the doctor's permission, and she was home 8 days later.
Oh.
So it saved her a year's. Well, she was expecting another year to attend the child every day. And so there she is. She's home 2 weeks after. She's on a swing. Some of the other photographs there, she's looking like a very happy, joyful young girl.
That's great.
I feel very good about that. But I just put that there as that's an exceptional type of, or very unusual place to be. But it just shows you not so much that the wheatgrass is healing, but it's messaging. Or it's reopening the messaging, because nothing's going to fix that to the point. You see, what's happened is the child's skin is not as inflamed, and it's strengthening. The doctors must have seen that to be able to send her home, because that's what they were worried about. They didn't want that to burst open again, but they were planning another year in hospital.
Wow.
And so I'm very proud of that one. And I get a hell of a kick out of these things, believe me. It's worth working all day for, because I suppose it's more like it's more like a passion than anything to me. But I've got hundreds, probably thousands of these cases now.
But anyway, I think the key is, like I say, picture's worth 1,000 words, but these are real cases with you, and they're really fascinating. And again, I'd like to have the opportunity to speak with you some more, to continue on our conversations, because it's so beneficial to people. But I think the key is that people need to be curious, and they need to be open to the possibilities of this, which you've learned from experience. And one thing you say, you repeat that you're a slow learner, but you're a fast healer, because your intuition was fast, but your science mind caught up later. But your intuition was amazing, and you help people without even the knowledge of the way it works. So I'd like to say that people should really learn a lot from that example, that, you felt from your heart that it was going to work. And guess what? It did. And you've been doing it again and again.
I get a hell of a kick out of it, believe me. But look, I really appreciate your time here, Joe. You've been very kind to me. You've been fair and not too, outrageously vicious or anything like that. I'm used to it anyway. I could handle it, But no, I just love seeing. And when I was that little kid, and especially kids, when you see them getting better, you sort of think, well, that's really worthwhile, and it does happen.
I think we gave some really good information, and these will be repeated, because this is the real deal here of exactly what's happening. And for myself, I'd like to also agree, tell everybody out there that I've been using this for a long time, from a quadriplegic, skin problems, people put it on their knees, all kinds of things. And yes, I would like to just collaborate or condone what he's saying, that this is amazing. And I think it really needs to be, I think people need to pay attention to it. And I think that's my goal, that people really listen and pay attention to it. And thank you very much for sharing your knowledge and your wisdom in these great cases. I appreciate it very much.